All right, so when we're talking about the blood supply here, so we have the circle of Willis. What's the circle of Willis? This is a vascular circuit, okay, like you can see, that's formed by the anastomoses between different branches of the internal carotid artery and the vertebral arteries, kind of surrounding the optic chiasm and the pituitary stalk. Let's just look at some of these arteries. Now, you have to be able to identify these arteries. I like, personally, either starting with the carotids or starting in the posterior circulation to get my bearings. So let's start in the posterior circulation. I think this is the easiest way to go about it. So let's start with the vertebral arteries. So you can see the vertebral arteries coming up here almost like a wishbone. Okay, so here's your two vertebral arteries, and you'll see that the vertebral arteries are going to come together at this one big artery in the middle. That's the basilar artery. And also, remember, the big artery that comes off the vertebral arteries is going to be the posterior inferior cerebellar artery. It's not depicted here, but it's this artery hanging out over here, coming off of the vertebral artery. Okay, let me write that in for you. So that's going to be the pica. Now, what's the significance of the pica? All right, going back to the last video, lateral medullary syndrome, right? That's the big one. If I have a dissection up through the vertebral artery, if I have cervical neck trauma and I dissect up this way, that can dissect into the pica and that can cause a lateral medullary syndrome. Okay, so remember that. So going up from the basilar artery, we have this artery kind of back here. Okay, so it's a little bit hard to see because it's running behind this big artery. So this artery here I'm highlighting in purple, that is going to be the posterior cerebral artery. Okay, so you can see it here. Same concept. It's kind of going back this way. That's the posterior cerebral artery. Think of it as it's going back kind of this way, back posteriorly over to the primary visual cortex. Okay, so that's the posterior cerebral artery. Okay, so this one should be the easy one for you. This one is this big artery here. This is going to be your carotid, okay, your internal carotid artery. Okay, so that's the really big artery you see here. And then coming off of the internal carotid artery, there's two big arteries I want you to know. The first one is this guy, okay, going off kind of everywhere laterally out here in the brain. That's the middle cerebral artery. Okay, so you can see it here. And then you can see here the posterior communicating artery is actually going to help connect this posterior circulation over here with more of this anterior circulation over here. It's not depicted super well in this image, but just keep that in mind. And remember, the posterior communicating artery is really associated with the oculomotor nerve palsy. Okay, and then the anterior cerebral artery, okay, so it's kind of hard to see here the way that this arrow is pointing, but it's essentially like this. Okay, so that's the anterior cerebral artery. It's kind of going anteriorly here. And remember what I said, if you picture your sensory or your motor homunculus, picture somebody sitting up on top of this ledge and we're kind of looking from the bottom up. And we can see their feet kind of hanging over the ledge. Okay, so this is supposed to be this person's feet hanging over the ledge. That's how I remember that this is primarily associated with the lower extremities, right? The lower limbs. When we have an anterior cerebral artery infarction, that's what we're looking for. Contralateral motor and sensory loss in the lower extremities. Finally, you have the anterior communicating artery. I'm running out of colors here. Let's use gray. If you guys can see this well, that doesn't look very good. We'll go with red. So this red color here, this is going to be the anterior communicating artery, connecting these two regions here. So that's the anterior communicating artery, and this is particularly high yield because this can compress on the optic chiasm. Okay, so these are the major arteries. I think I hit them all here that you should be able to recognize, either if we took a circle of Willis diagram, something like this, if I removed the brain here and just gave you the circle of Willis, or if I put a brain here, if I gave you an angiogram, you should be able to identify these arteries. Okay, so this is particularly high yield.